Hi, I'm Selena Lowe from the Monash Sustainable Development Institute, and I'm going to be a moderator for this event. I'm delighted to welcome you to our first of Planetary Health Dialogues and launch of the Medical Journal of Australia's themed issue on sustainable healthcare. In the context of our recent summer of bushfires and now the COVID-19 pandemic, this discussion and publication could not come at a more critical time. I'd like to begin by acknowledging the traditional owners of the land upon which we meet, the people of the Kulin Nation, and pay my respect to elders past, present, and future. I also wish to acknowledge First Nations peoples globally and to acknowledge each of you for giving your time in trust to us here today for the next hour. The Planetary Health Dialogues are planned to be discussions on critical, social, economic, and environmental issues that we currently face. We hope to use the knowledge base of published evidence and apply them to the challenges that are within our reach to invite global leaders who are at the top of their game to a dialogue where everyone is most welcome, regardless of background, culture, sexuality, religion, politics, or even the stage of your career. The format, technology, and content will evolve as we do. So for today, we have a distinguished cast of speakers who I will introduce in a few minutes. This themed issue was in fact published yesterday, and you can see many of the papers online. This launch was initially planned to coincide with David Penchion's Australian tour, with him as the guest speaker for the annual Congress of the Royal Australasian College of Surgeons. Because of the pandemic, he was unable to travel, but we are delighted and so grateful to David for his presence at this launch at an ungodly hour in the UK, calling in from Dorset. So to begin, I have a few boring housekeeping messages, but the good news is that there are only 4. The first is, please be patient with any technical difficulties. This is our first time holding the Planetary Health Dialogues in this format. It's my first time hosting in this format, and we certainly do have a lot of speakers and quite a number of you. From our last check, there were close to 500 registrants. Secondly, this will be recorded live, so if you need to leave early, you can catch it later. Third, we will open the Q&A now, but the questions will only be addressed after the presentations. To ask a question, please hover over the Q&A tab and write your question there. We will try as far as possible to curate the questions to address to the panel in the time that we have together. Last, but most important, please let us be civil in our exchange. Our world has changed rapidly, and with it, we need to find new ways and methods to learn together. This means that webinars and social media open up new opportunities for us to speak globally and exchange, but they also open up risks. So if we maintain in the spirit of learning and friendship and collegiality, I think that is the way to proceed. So for our agenda, we will first have welcoming remarks, followed by short author taster presentations from 3 of our authors, and then our distinguished keynote guest, David Penchion, calling in from the UK, and finally our Q&A. So without further ado, I'm delighted to invite welcoming remarks both from Professor Tony CAPON, the Director of MSDI and co-editor of this new themed issue, and from the Laureate Professor Nicholas Talley, Editor-in-Chief of the Medical Journal of Australia, who needs no introduction to the medical community in this country for his leadership at the MJA and then in the multiple titles that he still currently holds. So over to you, Tony.
Thanks very much, Selena. With the raging bushfires in Australia last summer and now the pandemic, environmental health issues have never been more prominent in our country or indeed around the world. Health systems are currently scrambling to respond to the pandemic. As health workers, though, when we look ahead, it's important that we also address the environmental impacts of healthcare itself. That's what this MJA themed issue is all about. Sustainable healthcare is not just about economic viability. It's also about reducing the environmental footprint of healthcare. Certainly, we need to be more energy efficient in our hospitals and health centres. We also need to rapidly transition to using only renewable energy. As well as reducing carbon emissions, this will also reduce toxic emissions from coal burning, which currently leads to more than 400,000 premature deaths around the world every year. We should also harness the purchasing power of health systems, and this could help drive sustainable transitions in other business sectors, such as food and agriculture. For example, here in Australia, our state health systems have large budgets for food procurement, which, if we targeted that purchasing well, could help accelerate transitions to sustainable agri-food systems across our country. Excellence in sustainable healthcare will also require changes to models of care across all of our clinical domains. While these changes can be challenging, we must embrace them in order to secure the health and well-being of future generations. I'm really looking forward to hearing from our friend David PENCHEON today about his experience with sustainable healthcare in the UK. But first, it's over to Nick Talley, who's the Editor-in-Chief of the MJA. Over to you, Nick.
So thanks, Tony. It's a great pleasure to be here with all of you and everyone listening in. And it's also a pleasure to launch this sustainable health issue of the MJA. I guess this year should be sort of retitled as the year of planetary crises, and we're all living through one of those now. Although here in Australia, we lived very recently through the bushfire crisis. I'm a little bit worried a lot of people have almost forgotten about that. So look, I want to make 3 key points about what I think is most relevant here, at least to think about. Firstly, we have a real opportunity because of the current crises we are living through. And I'm always reminded of Rahm Emanuel, who was the former mayor of Chicago's words when he said, "Never let a serious crisis go to waste." And I really think we need to take those words to heart, because we're facing not just the current COVID crisis, we're also facing multiple crises. We're facing issues around waste and pollution, food and water insecurity, overpopulation, misinformation, anti-science, dangerous technologies, and that's just a few of them. And these issues really are important for us to tackle together. And this crisis, at least potentially, gives us the option to drive major change. But I think the health professionals need to be part of driving this, and that's critically important. And that's my second point. The health system, our health system, is part of the problem, and we, in my view, need to lead by example. And here I'm reminded of Albert Einstein, who said, setting an example is not the main means of influencing others, it's the only means. And I agree with him. You know, Australians' carbon emissions, but the health system accounts for what, about 7%? We as individual practitioners need to do more to drive that down to zero, and zero soon. And I think leading by example as health practitioners, as health researchers, as public health physicians, etc., as leading this could make a real difference. And we can lead in our homes, we can lead in our practices, we can lead by what we do with travel, we can lead with what we do by educating others, and we can influence the health system. And I don't think we've done enough here yet, but we need to. And now to my third point about this, and this is really relevant as well, we at the MJA are stepping up. The MJA is very proud of this sustainable health issue. We're also part of our, proud of our partnership with the Lancet on the Lancet MJA country countdown reports on climate change and health, which we have every intention of continuing as long as the Lancet wishes to do so with us. We're proud too that we as a, we're stepping up within MJA also to try and lead by example. For example, AMCO, the company that publishes the Medical Journal of Australia, has an investment policy that rules out any direct investment now in fossil fuels. We're planning a staged reduction in print, although we've got a lot of work to do here. We're wrapping the MJA in biodegradable plastic, but we're very concerned about waste, even this. and we'd like to see this really go down very significantly. And we're committed to evidence-based updates so we can drive policy change in the country, in the states and territories of this country, and hopefully also provide some input internationally. So we're looking to work locally and globally to make a real change. Now, I'm part of the medical profession and I know how conservative we are. We are really conservative. But look, I really believe at this stage, in view of the crises we are currently facing and the new ones on our doorstep, the time for complacency is over. The status quo has to end. We need to lead a sustainable and healthy future. And I hope this issue of the MJA helps drive some of this. Of course, it's only just the beginning. Thanks very much. Back to you, Selena.
Thank you very much, Nick. So now we have three authors joining us for the next part of this webinar. The first is Scott McAllister from the Centre of Integrated Critical Care at the University of Melbourne. So Scott has an amazing transdisciplinary background. Not only is he trained in physiology, pharmacology, but also in energy systems and water resource management. More than that, he headed his own startup consultancy in this field. And today, Scott will be talking about sustainable pathology testing. Over to you, Scott.
Thank you. Thanks, everyone, for the opportunity to talk about the study that we did. Testing in the hospital setting at Austin Hospital and Sunshine Hospitals here in Melbourne. And we looked at arterial blood gas, full blood examination, coagulation profiles, urea and electrolytes, and C-reactive proteins. Now, to do this, we use something called Environmental Life Cycle Assessment, or LCA. LCA looks at the impacts of products or services over the whole life cycle of going from raw material extraction, so that's things like mining or agriculture, material processing, such as turning ore into metals, making things into parts, using them, and then the end of life. Now, looking at the whole life cycle is important for a number of reasons. If you make a change in one stage of the life cycle, you can cause a shift an impact to another stage of the life cycle or to another environmental impact. A good example of this in healthcare is there's a desire to reduce the use of single-use plastic items because we see lots of plastic going to landfill. But quite often this can result in a greater greenhouse impact due to the sterilisation of reusable items. There are, just trying to get the link to the next slide. I can't see my little, oh, there we go, sorry. Now, there are two ways of doing life cycle assessment: attributional and consequential. Attributional is almost like an accounting way of doing things. You've got the total impact and you divide it between all those things that make up the impact. And consequential, there's a different question. We're asking, what is the impact of an additional item? So using the train as an example, the train's running regardless of whether there's a passenger hopping on it or not. Each additional passenger means that there's only a small additional weight for the train's engine, so a small impact. Compared to attributional, we are taking the impact of the whole train and dividing it amongst the number of passengers. So for our study, we used consequential LCA. And we specifically asked the question, what is the impact if you order an additional test? We've given the impacts in grams of CO2 and also in kilometres driven in a passenger car. From the graph, you can see the majority of the impact is actually happening during the collection phase. So that is collection tubes, gloves, and swabs. So the actual analysis phase is quite tiny. You'll notice that C-reactive protein has quite a low impact. This is because C-reactive proteins are only very rarely ordered by themselves, and they're normally always ordered with UNE. So using the train analogy from before, the UNE is like the train that's happening anyway, and the CRP is just acting like an additional passenger. Whilst in You may have heard the mantra of reduce, reuse, recycle. For pathology testing, there are no real opportunities to reduce or recycle. And that's the same for most of healthcare because there's concerns around infection control. So therefore, the only real opportunity to lessen environmental impacts is to reduce. A meta-analysis from 2013 found on average 20% of tests are unindicated, which suggests that there's a very real opportunity to reduce impacts without changing clinical outcomes. Thank you.
Thank you so much, Scott. So our next speaker is the co-editor of this MJA themed issue, Professor LYNNE MADDEN, who among many other distinguished titles, holds the current title of Inaugural Professor of Population and Planetary Health at the School of Medicine, Sydney, University of Notre Dame. She's also the chair of the Climate Change and Health Working Group of Medical Deans of Australia. She will be talking about some of the themes in the other papers in this issue and capacity in the health workforce and training for this era. Over to you, Lynn.
Thank you very much indeed, Selena. And I'd like to draw our attention back to the arresting cover of the issue and the bushfires as a graphic illustration of what lies ahead unless we take a concerted action to change our practices. In Australia, sustained heat and drought combined to create extreme fire weather and bushfires that burnt from September 2019 to February 2020. This picture is taken from our clinical school at Lithgow Hospital on the 22nd of December, as fire in the Blue Mountains west of Sydney burned towards the town. Ron, can you help me to advance? Thank you very much indeed. As we're all aware, associated with these bushfires was sustained hazardous air pollution. These are pictures that I took from the air from about 30,000 feet, flying over the fire front or part of the fire front the next day. You see rising up through the extensive, dense smoke haze, the pyrocumulus nimbus clouds that the fires formed. Thanks, Ronnie. Next one. And these two pictures show what it was like down on the ground. Here again to the left, a picture of the University of Notre Dame Clinical School in Lithgow, shrouded in smoke haze. And to the right, a picture I took landing at Sydney Airport on the 31st of December. It's estimated that during this period that half the Australian population was exposed to sustained and hazardous air pollution. And as we know, there is no safe level for air pollution. In Sydney, at times during that period, it reached 12 times over the hazardous level. As health professionals, we must take the opportunity to shape a better, sustainable future, and articles in the issue show how. Brett Sutton and Taran Wiramanthri, in separate papers, introduced the essential role of regulation and policy to create the platforms for change within health systems to address climate change. However, the capacity of a health system to respond is limited by the understanding and engagement of the health workforce. This has been demonstrated by the WHO, who's found that the implementation of national climate change and health strategies was obstructed by limitations in health workforce capacity. For example, in the paper that Scott has just presented, in an area of practice like pathology, where health professionals must be informed to be able to take the actions that Scott has described to drive down the carbon footprint in pathology provision. In medicine, there is a hunger for environmental sustainability education amongst medical students who want to be part of transitioning the health system to an environmentally sustainable future, a hunger that we don't really meet. As we have seen also in the response to COVID-19, medical programs in Australia and New Zealand are collaborating to address the health effects of climate change so that medical graduates are fit for these future challenges. It also provides a model that can be used by other health professional groups. For health systems to provide excellence in environmentally sustainable healthcare, which is what we seek, and to actively shape the future of practice in healthcare, they need an informed health workforce. They need a health workforce that is supported by excellence in environmentally sustainable health education. Thank you.
Thank you very much, Lynn. And to let you know that some of our other authors of this MJA issue, such as Brett and Jeffrey Morgan, are also in the audience with us today, thankfully. Very grateful for your time. And we will try in the Q&A session to throw some comments your way also. So our final speaker from the MJA issue in this session is here, not necessarily in his authorship capacity, but in fact, calling in from hospital as a frontline worker during the pandemic response. Dr. Forbes McGain is an intensive care physician and an anaesthetist at Western Health. He is a member of Doctors for the Environment Australia, many of whose members are in the audience today too. And although his bio says he's a national leader, he is in fact, in my opinion, an emerged global leader in the drive for healthcare sustainability. I've had the pleasure to work and learn from Forbes and David on a number of occasions. As many of you clinicians know, access to PPE has been the source of much stress, trauma in many countries. The lack of it has risked infection among many of our healthcare workers. Like clean air, water, sustainable health systems, PPE is in fact thinking about what sustainable supply really means. Forbes, we would be interested specifically in what you think, in your experience, in terms of the differences in response to COVID-19 and to climate change that you see as a frontline doctor with good experience of the health impact of both. Over to you, Forbes.
Thank you very much, Selena. And thanks to the MJA for this interesting and very worthwhile edition. So, yes, it's quite interesting thinking of the contrast couldn't be greater with how COVID-19 has affected my working life and all of our lives, but particularly in hospitals, compared to climate change and the climate crisis. The contrast couldn't be greater because the COVID-19 is something I can say, you've got that SARS-CoV-2 virus and we're going to isolate you and I'm going to wear PPE or personal protective equipment. And you can't label Forbes McGain with climate change because we've all got climate change. It affects us all. It's a very different story, and people talk about this wicked problem that exists with climate change as opposed to, say, a virus, which you can label everyone with if they have it. And the whole issue of personal protective equipment is an interesting one because I think it shows in stark contrast how global supply chains, the externalities of a globalised world can quickly unravel when you've got something like a pandemic, because we are at the end of a supply chain that originates far away from us for the delivery of gowns and gloves and N95 masks and even surgical masks. And I think it just shows you how problematic it can be in not having local manufacturing and local reusing of products. And a really good example of that was when I suddenly just thought to myself, and I said to some of my colleagues, I said, do we actually even have a reusable infection control gown at all? Does it exist? And I went and looked a bit about this because we do, at Western Health, where I work in Melbourne, we do have some reusable surgical gowns still, which are called level 3 gowns. But to be an infection control gown, you need to be level 4. And we don't have any. We just don't have any, and I don't know anyone anywhere in Australia who has reusable infection control gowns. And I thought, well, this is a virus that just can get, removed with a bit of soap and 60 degrees hot water. You can eradicate the virus relatively easily. In fact, more easily than if you're washing a gown with blood, down with blood from a surgeon's work, for example. And so it begs the whole question of how do we move forward to make a more reusable, a more sustainable, and more within the hospital process, rather than relying on these wild global supply chains, which affect, as you know, also very much pharmaceuticals. And so I'll just maybe end with, I don't know if Ronnie's got a picture at least of some of the other work we've been doing with all sorts of interesting work we're doing with engineering in particular, to try and think about how we can try and reduce the risk to patients and try and reduce the risk to staff as well with personal protective equipment, devices that will actually improve outcomes for patients and allow them to have non-invasive oxygen, face masks, and reduce the risk to staff from developing infection from COVID-19. Ronnie, I don't know if you've got a picture there for the audience, if we got that from the, perhaps not, but, there we are. Okay, so this is an example of the hood as we talk about. So one of the first things, so what this is designed to do is as negative pressure, a small negative pressure room in a sense within the hood. The patient goes within the hood there, is a bed you can see. It flips down like a pram hood does. And it's got a little fan at the back with a HEPA filter. So it basically draws air away. And this is something we're thinking about because we thought, well, we don't have enough negative pressure rooms, so let's develop this. Some of my colleagues quite wittily said, oh, well, you know, you're wasting all that plastic. But the good thing is with the plastic, we can actually wash it. So we're trying to be as sustainable as we possibly can. Thank you for your time.
Thank you very much, Forbes. So now to our distinguished keynote guest, calling in from Dorset, Professor David PENCHEON. David is the founder and former director of the Sustainable Development Unit, NHS England and Public Health England. He was previously director of the Public Health Observatory in Cambridge and has worked as a clinician, director of public health training within the NHS R&D program, and also previously with NGOs in China. He's an honorary professor at UCL London and a visiting professor at the University of Sydney Centre for Environment and Sustainability. David is many things in his career and distinguished titles, but among all those things, for us who've seen him at work, he is really a catalyst for change through his conversations. Not only his vast knowledge, which he is very generous to share, but his extreme generosity of time and patient effort to helping communities and groups adapt their context to a more sustainable future. I'm delighted and honoured to welcome you virtually to Australia today, David. Over to you.
Great. Thank you very much, Selena, and thank you and welcome to everybody around the world. I'm just going to briefly try and emphasize and echo some of the great words and deeds we've already heard on this webinar, and really pay a little bit of attention to the experience we've had in the UK on 12 years really of work in this area funded by the state. So all I'm going to do is highlight three important lessons. So if we just move on, Ronnie, to the slides, if we can. This is one of the most important slides for me, because for all of us, it shows you where we all are and actually how we can get confused as to which part of the system we're talking about. I just want to spend a couple of minutes here. This is around, the red is the bad news and the green is the good news. This is where the health and care system has, we hope, a positive effect on health. But of course, climate change and environmental degradation has a terrible effect, both on health and on health systems. And the sort of the critical issue is that health and care systems, as we've heard in the great work published by the MJA, has a terrible effect on climate change as well. So this is the dynamic about where I would hope that you would understand we're coming from. So the second thing is that we are in the health and care systems, we are some of the most trusted professionals, people. And that issue that Nick Talley referred to is if we don't do things in the health and care system. Here are the 5 most trusted professions as judged by the public in 2019, as judged by Ipsos Mori. Now, all of those, they're all healthcare professionals. So if we're not seen visibly to act on this issue, and I think, just echoing Nick's words, this is not, I think, the year of planetary crisis. This is the century of planetary crisis. We have 10 years from now till 2030 will ultimately determine whether we reach the end of this century on a livable planet. So, you know, no pressure. And we, in the health and care system, if we are not seen visibly to act, we're letting it's a huge responsibility we have. So 3 lessons I just want to think. The first is measure, 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 measure. It's a little bit like test, test, test with COVID. And that's why I absolutely have to pay tribute to Scott and Aranima Malik and Manfred Lenzen for all the work they've done in Australia by highlighting this. This is just what we did in the UK. Just that's the graph of where we've come from and where we need to be. This is not a bit of efficiency. This is system change. Climate change is about system change. This is a huge reduction, 80, 85, 90% reduction we need. We need to find out where it comes from. And as Tony CAPON has so eloquently said, this is about things like procurement, about buying stuff. And thirdly, in this first lesson, is we have to realize as a health and care system what we're going to do as far as global and national actions are concerned, what would happen anyway, what the health sector has to do. And that's why the contribution, you know, of people like Forbes is crucial about what on the front line, how we develop models of care, what is the kit we buy. And even thirdly, we've still got a gap. So the health and care system still really has huge responsibilities and huge potential in this area. Okay, Ronnie, if we could just advance one more. Thanks. And nextly, we have to say what the success has been. So we're very clear in the UK, in England, that we had to say how we were reducing the footprint and how we were doing this at the same time as increasing healthcare activity through huge efficiencies, and also how much money we were saving. So we'll go on to the next slide now. And the second lesson I would say from the past 10, 12 years is make it core to business and relevant to, now you've got to make it relevant to all stakeholders. That's professionals, public, policymakers, politicians. And one of the ways we did this in the UK was we changed the mantra of the whole healthcare system from high quality care for all to high quality care for all now and for future generations. The healthcare system as a system we don't tend to do the future. We love emergencies, we're crisis junkies. We have actually really got to get a grip on what we're doing and its effects on the future. And then we've got to make it relevant, embed it in the quality of what we do. So one of the big barriers to doing this, to taking environmental degradation seriously, is it's seen as a nice add-on, not as core to quality. Now, the Royal College of Physicians in London have really now embedded sustainability, and through the work that people like Nick Talley and other colleagues in Australia have done, it's quite clear that you're embedding that in the quality issues in Australia. And this is just one very, very simple example to show a little bit like what Forbes is trying to do in Western Hospital. That this is just an ambulance system in the UK, which emits a huge amount of emissions through idling of ambulances, and they've simply taken available technology like photovoltaic cells so they don't need to idle their ambulances. It saves money, it's cost effective, it's clean, it's healthy, and above all, it's symbolic. People can see this sort of stuff happening, so they can see that the health and care system takes this health issue very seriously. So the last issue before we go on to the Q&A is about communication engagement. This is absolutely key. And if there's one lesson I've learned in all these years, it's to stop calling climate change an environmental issue. Clearly it's an environmental issue, but as a health professional, it's important to call it a health issue. And this is what was learned through a lot of work in the IPCC and all those people contributing to that, is that we have to stop talking about it as just an environmental issue over there. It's a health problem now, and thus health professionals have a huge opportunity to do something about it. Okay, Ronnie, if we could just move on a bit more. Thanks. And just to sum up, really, so it's very important when engaging and talking to people to understand where they are coming from. So the biggest lesson in I think communicating is listening to where people come. And Tony was saying about an economic frame, the legal frame, but there are so many other frames. And I just want to point out the legacy and leadership frame. And if it weren't for people like Nick Talley and Richard Horton at the Lancet and Fee Godley at the BMJ, we wouldn't be normalizing this as much as quickly as we have been. So a huge recognition of that fact. So lastly, remember that taking action on climate change and sustainable development in the health and care system is not a nice add-on when you can do it. It's not a trade-off. These are health co-benefits. We would be doing this anyway. We would be saving money. We would be preserving nature. We would be having more sustainable procurement pathways. So there's a win-win here. So if there's any sector in the world that should be taking a visible lead on this, it's the health and care sector. And I suppose the last slide, Ronnie, if we can move on one more slide, that sort of sums up how you can synthesize a communication message and lighten it as well, so that we don't come across as so worthy. So I'm very much looking forward to the Q&As, and thank you, Selena and Nina and Tony at the SDI for hosting this fantastic webinar.
Thank you very much, David, for joining us. So the current situation with our Q&A is that we have a few questions that have started to trickle in, and we've had a few of you email us before this, in fact, started. I will start to put live some of the questions from lockstep with expert science, mainly. So with politicians in lockstep with expert science, is this the moment in time where we can renew the focus on evidence-based policy and practice for sustainability? Over to you, David.
Yeah.
Did you hear the question?
Well,
yeah.
Yeah, I heard the question. I mean, I think one of the issues is that and COVID's a very good example about this, is that when things really hit the fan, we dive into our emotions about what we think need to be done rather than looking coolly at the research. And I guess we panic. And I think there was a very good editorial in The Economist saying that this is at times like climate crises or COVID crises, it's when you need science more than ever. Now, that doesn't mean to say that you have to wait years and years for long trials to come through. Not all science takes that long, but there's a great temptation when things get tough to resort to our emotions and our beliefs and our faiths and dogma. So absolutely, never has it been a better time for evidence. And that's why the critical role of journals in this, in not only publishing good evidence, but commissioning good research so that people know what's on the horizon.
Thanks very much, David. So I would like to link this question to you, to one of the authors who I know is in the audience, Geoffrey Morgan, Professor Morgan at the University of Sydney, an expert on air pollution and also climate change and health. I'm hoping that, Ron, you can connect to Jeff, and Jeff, to give you a couple of minutes both to answer specifically to this question on the focus on evidence-based policy and practice, whether it's this is the right time, and perhaps also share with us some of the main messages from your piece in the MJA also. So while we're waiting, we'll see if we can put some other questions live. So there is one. We have people calling in today from all around the world, including Hong Kong, Oxford, Cambridge. I didn't realise that we have Trish Schwertel on the board of MSF, who is a climate change and health expert, also calling in from Germany. And she is asking a question to Tony. She asks, Tony, we're talking about planetary health more and more in health, but then we go on to talk about carbon reduction in healthcare and climate change and health, a narrower view. How do you suggest that we truly engage in other planetary boundaries as health professionals? Biodiversity, land use change, nitrogen flows, they seem far away from us to influence as health professionals.
Yeah,
Tony,
no,
over to you.
yeah, thanks, Selena, and thanks, Trish, for the question. I think it's a really important one because, you know, my core work, certainly for the last 3 decades or so, has been well beyond what we might call a formal health system, working, as you say, Trish, with other sectors, whether that's the urban transport sector, the housing sector, the food and land use sector, for example. And of course, importantly in this country, you know, we need to be influencing the energy sector to accelerate the transition to renewable energy. So those are all critical things. And I think it's important that at least some health workers are reaching out well beyond the formal health system, the hospitals and the healthcare centres, the general practitioners, the nurses, to reach out and engage with, to work with, to encourage, to require action in other sectors. But importantly, what today's about is really making sure, I think, as Nick Talley says in the editorial for the themed issue, making sure that our house is in order. As healthcare workers, there's more that we can do in our own work. And I sometimes refer to the need for a planetary consciousness in all the work we do. Whether we're a health researcher, a health policy maker, a practitioner, an educator, we need to be reflecting on the implications of the decisions we make, the things we do, not just for the patients who we're caring for, but also for the health of the earth. And that is part of the legacy, part of thinking ahead. As David said, thinking about future generations. It needs to be a critical part of what we all do to reflect on the future. Thanks, Selena.
Thank you very much. Thanks for that answer, Tony. So there are a number for you, Forbes, in terms of PPE. I'm going to take 2 together. The first question is from Rhonda. She's asking a very pertinent question to ask, has anyone tried to assess the increase in waste from PPE during this pandemic? And then the second question is from Misha, the Global Health Alliance. She asks both Forbes and David, with regards to reusable PPE and other surgical basics like drapes and sheets, given what was said before about the life cycle costs of single-use plastic versus sterilisation, etc., how does single-use PPE stack up environmentally against reusable items? And secondly, if you can answer this also, if reusable items do stack up, can we use the crisis of this pandemic to steer the tertiary health sector, especially away from single-use plastics, and to support the local manufacturer? I don't know which of you was first, perhaps Forbes.
That was 3 questions, Selena. I'm male.
Sorry.
The first one, has anyone tried to measure? So not during this pandemic, and I think it's a pretty easy thing to do, but we'll probably have to do it at the end of the pandemic. You know, you could basically just look at the procurement requirements of a hospital. It's pretty easy to say, well, here's the year 2020, for example, years since the pandemic started, and then look at a similar period in the past. But it's pretty obvious to me, for example, one patient in one ICU that I work at for one day use more than 100 disposable gowns for that one patient who would normally not use any of them. So it's pretty easy to see that, you know, that's a pretty obvious problem. What we're able to do is reduce the amounts of it, but that's another story. The next question, so I'm already lost there. If you're comparing reusable and disposable, I think it was along those lines. Is that right, Selena? Yeah, okay. And I know Scott could give further discussion about this, but essentially a lot of it will depend very much on exactly what you're doing and how you're doing it. So if it's a gown and it just needs to be washed, but it's not sterilised, that's really important. Washing it doesn't use anywhere near as much energy as sterilisation when you go above 100 degrees for a steam steriliser, for example. It depends on the type of sterilisation, but let's just stick with steam sterilisation. So that's really important, because this gown, like an infection control gown, it doesn't actually have to be sterilised, because as soon as you open it, it won't be sterile. It's not like a surgical gown. So that's really important to know. The second point is, of course, where you are. That's important as well. I know it's the whole story, but if you're in New Zealand, then the whole world, the whole universe in New Zealand should be reusable. It's a bit harder to sell that story if you're in Victoria, which we're based on brown coal. But your energy source is actually really important as well. And probably thirdly, it's also how you actually use your sterilizer or your washing machine, that sort of thing, really using it very efficiently rather than just sort of having it half full because people couldn't be bothered filling it up. So the answer is it depends, as Scott, I know, will sort of wryly smile, but it does depend. But certainly there are, in general, certainly for gowns, reusable gowns are better than disposable. There's been about 5 or 6 studies now that have shown that. That might be a very different story for other types of equipment. Selena, will I answer the third question? Because I've actually forgotten what we used.
Well, there is actually one other that we want to answer live. It's from Grant Blaschke. And it's linked to this. Do you think that the COVID crisis is going to help or hinder action on sustainable healthcare? And perhaps David or yourself can answer this.
David, you.
Yeah, that's a really good question. I think it's going through a lot of our minds. I think the answer is yes and no, of course, because no in terms of, we're crisis junkies and clearly everybody wants to be treated well regardless of reusability, but there are pragmatic issues, as Forbes has said. I think in the long term, one has to be a pathological optimist in these situations, otherwise we're all doomed. But I think it's going to have what Tony CAPON referred to. It's got to increase our interconnectivity and planetary consciousness. I know that in the heat of the situation, we'll do anything to save lives. But I think one of the discourses that will come out of this, and in fact is already established in COVID, is there are direct health effects, people dying of viral infections, but there are indirect health effects. Now that could range from poverty, it could range from economic collapse, it could range from the pollution from incinerating disposable kit. And we may well find that the indirect health effects of this pandemic exceed the direct health effects. But even in the use of that language, indirect and direct, I'm almost being guilty of what I'm trying to highlight, which is direct are not more important than indirect. We have to see the holistic, the whole system approach to it. And I think one of the things it will reinforce is that ecological connectivity. Everything is connected to everything else, but we shouldn't make that phrase paralyze our actions. We should be utterly practical in. So, for instance, just to wrap up the answers that Forbes gave, it's all very well for us to say, well, clinicians should be using everything from non-disposable recyclable kit all the way through to hospitals cooking their own food. But quite often the infrastructure has been taken out of hospitals that allow people. In primary care, of course, it's very difficult now to re-sterilize and autoclave because the kit it's just not there, because we're obsessed with short-term gains and short-term financial savings, not long-term survivability. And it's something future generations will look at us and with extraordinary impressions about what we're doing now in the short term. Thanks, Selena.
Thanks very much, both. I'm starting to put some of the questions to the panel that I'd like them to think about for the moment and start to answer live. But in the meantime, I'd like to go to a question from, I'm just wondering who can best answer this. It's from Georgia Behrens, who was actually an author, a part of this themed issue. She says, we know we need to transform the way that most humans eat to improve both human and planetary health. A few colleagues and I have published a letter on this imperative in this issue of the MJA, calling on the healthcare system to make hospital food environments more healthy for humans and the planet. Practically speaking, how can we get the planetary health diet more widely adopted in our hospitals and healthcare system? So I know that some people from Vic Health were planning to be on this call, but I don't know who's in the audience at the moment. But I think this is possibly one that, Tony, I think you can at least take this one on, I think. You want to give it a go?
Yes, I'm happy to open it up, and David Penchon might also have some reflections from the UK experience as well, because I remember when he was out here a couple of years ago, he told us about some relevant experiences in hospitals there. But certainly, as I highlighted in my opening remarks, I think this is an area where there's a real opportunity for Australian hospitals and healthcare systems, particularly the state level. In New South Wales, I'm aware that the New South Wales health system is the largest procurer, buyer, if you like, of food in that state. And so that's an enormously important opportunity for the health system to use that purchasing power to encourage providers of food for the health system to deliver for patients food that is both healthy for the patients, modelling good food provisioning, but also food that's been produced in the most sustainable ways. And that will, of course, require that that be in the procurement guidelines. And that's a shift in policy that's required. But maybe over to David Penchon for a view from the UK as well.
Yeah, thanks, Tony. Yeah, so I would echo that entirely. I think that's absolutely right. It's coming back to the example issue that Nick Talley referred to, that the food you get served in hospitals, well, not only is it part of your recovery process, but actually it employs people, it can keep things local, it can promote biodiversity local. There was one stage in the English healthcare system where the vast majority of food in English hospitals was actually cooked in Wales and trucked overnight in plastic cooked chills. It was probably the most unecological food system you could imagine. And actually in places like Nottingham and North Staffordshire in England, it's now turned around to be one of the most environmentally sustainable and circular economy like systems. So it shows you that change can happen, but change in a good direction does not happen automatically. You need proactivity and vision and collaboration. So I think food is a fantastic entry point into how the health and care system can become more sustainable. Thanks, Selena.
Thanks very much. So I have one question from the students or the new graduates. V. Tran, Dr. Talley, we love your textbook. I don't think there's a single medical graduate doctor alive in Australia who hasn't read your book, Nick, including myself. How can we get medical students to care about health systems, planetary health, when they have so many competing study priorities? I would like both Lynn and Nick perhaps to take on this question. Perhaps start with Lynn and then go to Nick, if that's all right.
Sure.
Thanks, Selena. I think the way to sort of embed environmental sustainability across the curriculum is to integrate it so that it doesn't sort of sit off to one side. It's relevant, as all of our speakers have shown, to all areas of clinical practice. And so it should be about how we reorientate the delivery of our clinical practice. And so consequently, it needs to be, therefore, embedded across everything that we learn across all years, from the basic sciences about what causes it, through to how do you deliver environmentally zero carbon models of care. It's not something separate, it's something fully integrated to do it well. Nick.
So I think it's a combination of local leadership from the medical schools, driven of course by perhaps the groups of medical schools feeling this is important, and that requires leadership on that side. But also the student activities here are critically important. In my view, students can influence this from the ground up in ways that could be very effective as well. I know a lot of medical students are very concerned about this issue, and I don't blame them. It's going to affect them in their lifetimes and their children. So it's clearly really important. And I think being active here, demanding that this not only be taught, but in fact things be done to change the system so that in fact we're contributing to the solution, not just talking about it. To me, that's important. And I really believe we need to encourage the younger professionals of the future to drive this very hard, not just in medical schools, by the way, across the health professions.
Okay, so we've only got 5 more minutes, and the questions are so wonderful. I just want to tell you that we're going to find a way to answer your questions through the panel that we have and the other authors. And if we haven't gotten to them, we'll find a way to answer it in the next few weeks. So I would, however, like to end on the question, which I can't find right now, that was posed from Deakin Economics, Tony, to all of you on, let me just find it.
Would you like me to
Martin
read it out,
Hetchner,
Lynn?
that's it.
Yeah,
this is it.
Yeah.
Yeah, I'll read it out. So, Martin, as we come out, hopefully on the other side of COVID, there will be large-scale economic stimulus and investment programs. As Forbes mentioned, there will be also lots of onshoring of supply chains and a big boost to local manufacturing, both of healthcare products and pretty much everything else. I fear we will not get a Green New Deal in Australia, but how can we bring realistic pressure to bear to ensure that new local supply chains cause less environmental harm than those they replace? So perhaps Tony and Forbes and Scott can take this on. Whoever wants to go first, just jump in.
Perhaps if I jump in first, Selena, I think this is a really important question from Martin Henscher, and it's really, if you like, about the opportunity coming out of the pandemic to build back better. This is a language that's starting to be used by our governments around the country, and it's critical, as Martin says, that the investments we make to get the economy moving again also help to accelerate decarbonisation in our country. And Climate Works, which is part of MSDI here at Monash University, put out a new report on decarbonisation. And the fact that the technologies are available, it's really about getting on with it now. And so that's a real opportunity for us. Importantly, it's not just about decarbonisation. It's also about stimulus for well-being more generally. If you like, it's about stimulus that helps deliver the 17 SDGs. But I might pass over to Forbes as well for a comment.
Thanks, Tony. I think it's a really interesting question, one I've been sort of thinking about for a little while now, because as David PENCHEON said, the whole issue of being, in general, more environmentally sustainable is also about security of supply. It's about resilience. It's about having local manufacturing and working together to make it a better world. I really think that the pandemic has revealed that in all its troubles. And a good example of this is, you've probably heard, one of the Melbourne companies, and there's a WA company, there's also a New South Wales company, they're trying to build ventilators. Well, we used to make our own ventilators. They used to be called Olcos. I used to use them. We got rid of them 20 years ago because it was just easier and cheaper in other nations to make it. But the pandemic reveals the worries of how that is an unsustainable solution when everyone is grappling and wanting ventilators, for example. And the same would be with PPE. I think it's a really interesting, it's a difficult question, but I think it's a really important one that we as a nation need to really think very carefully about, because this won't be the only pandemic. Pandemics are completely predictable things, and there'll be more of them as we keep destroying more of our planet.
Much. Thanks very much, Forbes and Tony. So I would like to invite, just in the final minutes before we close, the two co-editors, Lynn and Tony, and Nick, as the editor-in-chief of the MJA, to give us your one wish for sustainable health healthcare if it could be granted in the next couple of years. First, let's start with Tony.
Well, thanks, Selena. I mean, I think this really illustrates today that we're beginning to get on a pathway to sustainable healthcare in our country. And I think that's really important. We've got a long way to go. We're seeing in different jurisdictions around the country, different opportunities emerging. But really, the wish for me is that we get better at sharing what we've learned. Today, we've learnt more from David PENCHEON in the UK, but it's really about sharing better across the jurisdictions, across the health services, between individuals. And as Nick said before, between all health professionals, not just doctors. Thank you, Selena.
Much. Lynn?
Great, thanks very much indeed. Well, my wish is that we rise to urgent action. And as David has said, we've got 10 years to halve our carbon or greenhouse emissions. And it's time to stop holding back. It's time to start ramping up and ramping up really quickly. So that's my wish. Urgent action, please.
Thank you. And Nick?
Well, I'm a simple gastroenterologist. I'd like zero net emissions from the Australian health system in the next 5 years. And that means we need to move fairly quickly to actually achieve this. And what's more, if we could do it, it would actually show we are serious and how important this is, which perhaps will send a message to others as well.
Thank you so much. So I will, for the final time, invite Tony for closing remarks, and then we will close this session.
Yeah, no, thanks very much, Selena. First of all, I'd like to thank you for hosting our inaugural Planetary Health Dialogue here at Monash University, and we're looking forward to doing more of these, not just during this pandemic period, but well beyond. I think it's shown the opportunities here to really connect across the world and do it in a way that requires much less carbon emissions than us having to hop on the plane. It's of course disappointing that David PENCHEON couldn't be with us here in Australia for the Royal Australasian College of Surgeons conference. And LYNNE and my co-editor of the themed issue, of course, was Phil Truscott, the immediate past president of the College of Surgeons. And so we hope that this has been useful for the participants. I note we went well over 300 participants during the peak, and of course we've recorded this as an opportunity for people to engage beyond. But thanks to you, Selena, thanks to all the participants and to the speakers, of course. And we look forward to the next Planetary Health Dialogue. Thank you.
Thanks very much, Tony. So to all of you, thank you. Thanks to the brilliant MSDI team behind the scenes who pulled this event together at an unprecedented short notice. Nina and Ronnie, I want to name you. Thank you very much. As Tony said, it's our first dialogue. There'll be more to come. Please stay safe, keep your discussions alive, and thank you all for your leadership and efforts. We'll see you next time.